Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's really great to be here with you. And I hope that this podcast helps you breathe a little easier, feel a little bit stronger, and step into the profession with a little more confidence and clarity. This is the time of year where our students leave the nest. And so I have it on the forefront of my mind when I say, are they ready? Yes, they are. I know they're ready. They are ready. Entry level dental hygiene students all the way. And I think most of you just put a little too much pressure on yourselves when you get to the really end of your program and say, okay, can I do this? I want you to step into the profession with confidence and clarity. I'm your host, Billy, and today we're going to dive into a topic that is shaping the future of dentistry in a big way. Even though most students barely hear about it in school, I know that it is talked about in some of our faculty meetings. We are talking about sustainability, what it means, why it matters, and how you, yes, you, are part of the generation that is going to redefine what dental care looks like. Take a deep breath. Shake off whatever stress you pressed play with, and let my voice help reduce your stress. Ease your worries, relax your nervous system, and open your mind. All right, let's get into this. Here's a wild fact, guys. Healthcare is responsible for about 5% of the global carbon emissions, and dentistry plays a measurable role in that footprint. If you don't believe me, come to pre-clinic with me while we watch all the dental hygiene students learn how to disinfect their units and set up their operatory, put all of those barriers on, and then turn around and throw them all in the trash. It's one of the most painful things to observe, I gotta tell you. Dental hygiene is uniquely positioned to change the sustainability issue. Is it possible to be sustainable and reduce water and waste and all of those things while still caring for patients and maintaining infection control protocols? This is the question that I ask myself every year when we go through the disinfection protocols for our preclinical students. And it's really a hard question to answer. But I got to tell you, I think that dental hygienists and dental assistants are the perfect professionals to take on this challenge. Why do I think that is? Because prevention is the most sustainable form of healthcare. I want you to think of sustainability a little differently than, just using reusable bags or reusing anything. I want you to think a little bigger when you think of the word sustainability. Every cavity prevented, every case of gingivitis reversed, every patient empowered to take control of their own oral health is part of a sustainability plan. And if you don't believe me, think about this. Fewer materials, fewer appointments, fewer chemicals, fewer disposables, fewer emissions, fewer everything, and a lot less invasive, fewer dentally anxious patients. Can you imagine what it would feel like if we worked in a dental office where you did not hear every day, I hate the dentist. I hate coming. I don't like being here. Are you almost done? Like these can wear on you, right? So part of a sustainability plan is promoting prevention. You, as the hygienist, are literally practicing sustainability every time you help someone avoid disease. Prevention is power, and prevention is the main focus for sustainability to be effective. So students love this topic because it's not just about being green, right? Often, I think sustainability gets a really closed-minded perspective. I really want to open your mind to what sustainability really could look like if you think about it. Okay, this is about being a leader in a profession that is evolving so fast. You can evolve with a green mindset. And in that green mindset, I want you to think of sustainability. Sustainability meaning how can we sustain our business model? How can we sustain our profession in a way that keeps these things in mind, right? So, what sustainability actually looks like in dentistry, it can include all kinds of things, supporting the materials and products that are less harmful to the environment. Yeah, that's an easy thing to think of. But choosing prevention over intervention, minimizing the energy use, using digital technology, choosing reusable in an ethical way, right? Reducing waste, but thinking about something a little deeper than that. What about the patient's entire journey? So we're not just talking about treating disease, we're talking about preventing it, predicting it, and then empowering our patients and supporting their efforts to avoid it altogether. That, guys, is the heart of sustainability. And that requires a huge amount of effort on your part as a clinician to educate and empower your patients to seek prevention and avoid the interventions. How do we lift up the standards of our patients? We improve access. So those access initiatives are part of a sustainability plan. We know that prevention is more sustainable on a business side, on a cost-effective side, but then we have the other parts. There are other things that we can know, we can do as a profession. The things that you see in those CE courses, the forward-thinking practices, the job interview questions that are going on, those are the types of things. Think about just how much dentistry has changed. If you think about sustainability and how much dentistry has changed just in the last 10 to 15 years, let's take something really simple and easy to understand. Radiology. Radiographs, think about the sustainability plan of x-rays, the cost-effective behavior of moving digital. We used to have these huge machines to develop radiographs. It was full of really toxic chemicals, developer and fixer, contaminated water. You would have to clean the machine and make sure everything was functioning so that you could get quality radiographs coming out of that machine. Every 28 days, you would have to empty and refill and all these things and put all new chemicals in, dispose of the other chemicals. And we thought this was normal, right? You had to buy film, you would process the film, these would go into the patient's chart. Now you have all of this cumbersome stuff that's everywhere that ends up in the landfill. Not only the chemicals, but the actual film that the patient has in their records. And if you don't think those things add up, oh my gosh, over time, tons and tons and tons and tons. Not to mention the sustainability of constantly buying the film and removing the lead barrier that's in there, recycling the lead barrier, just using radiology as an example. The shift to digital has been a huge move on the level of sustainability, right? Having the packaging waste, the shipping emissions, the materials of actually getting the materials to the office, all of the different speeds and sizes of films that you would have to purchase and have on hand for the patients. Moving to a single product of like a digital sensor, one single product. Think about what that's done. No more chemicals, no more waste, instant access to whether or not you took a quality radiograph, and now add AI. Now your sustainability on time effectiveness, time efficiency, and better patient outcomes has been enhanced even more with the use of AI technology with the digital radiograph. So radiology is a really easy one to see how the sustainability plan isn't just about the physical items and the waste products, but the actual transformative movements that have occurred as a result of moving to something more sustainable. All of this digital technology with radiology is a great example. And how can we take that and use that in all areas of the dental office to make all areas a little more sustainable. Taking that and using CAD/CAM technology instead of taking impressions. We take the impressions, we ship that off to the lab. You have your packaging waste, your shipping waste, remaking errors, impression materials going digital. It is a perfect example of sustainability on a macro level. Think about the education that goes on for the patient when they're watching you take that digital technology impression and they are having a better experience through the entire process. Oh, I love all of these things. These are just great examples of how thinking about sustainability as far as like going green and then actually thinking about sustainability and going efficient and those things working together to make things time efficient, patient efficient, and being a little more effective and mindful in how you are treatment planning and how the course of your day looks. All of these things kind of stack up together in these little microbursts. It's one patient at a time, one experience at a time, one procedure at a time that actually impacts your sustainability and your progression over time. All of these things are just great. Now, that's just one example. I could go into all different segments of how workflows and sustainability plans work and really impact and support the needs of our patients and also reduce your burnout as a clinician. You guys work really hard to become providers. I really want you to remain in this field for the long term. And for me, in order for you guys to stay as dental hygienists, as providers, as clinicians for 20, 25, 30 years, you have to have a good sustainability plan for not only yourself, but the office that you work in and the patients that you provide for. Taking those CE courses to help you create your own sustainability plan for working 25 to 30 years, that's going to go a long way. Think about some of the remineralization products that we've had with Curodont and hydroxyapatite. These types of things, the nanohydroxyapatites that come on the market, the fluoride varnish, you guys, I know that you guys are just, graduating this year, but I got to tell you guys, even the fluoride varnish has exponentially improved over time. Just crazy. The lower environmental impact, the higher patient acceptance, and alternative choices for patients. These products really support the tooth's natural structure instead of relying on heavy restorative cycles. When our patients have to repair, repair, rebuild, repair, repair, rebuild, that's not a good sustainability model for any patient. It ramps up their anxiety, it reduces their feeling of being effective at home with managing their caries risk, managing their periodontal risk. So the time in the chair alone creates a sustainability plan that can be maintained when you start implementing some of these products that can really support the needs of our patients. So, oftentimes, when we talk about sustainability, the first thing people go to is reusable versus disposables, and that debate can carry on and on and on. So, there's two camps of people, right? This one could be a really tough conversation to have. So, for students who are going out into the field, it you might ask, is it okay to advocate for reusable items in a practice that uses disposables? Like, how do I navigate that? Do I ask that during the job interview? And here's what I'll say about that. Yes, you can advocate for reusables respectfully, thoughtfully, and with evidence to back you up. Reusable items, when sterilized properly, reduce the long-term waste and cost, and that is a small part of a sustainability plan. You may find that a mix of some reusables and some disposables meet the needs of the practice that you're working in. You just have to figure out the where, the what, and the how. You don't want to take on this type of topic in a confrontational way. You want to be a little bit more curious, informed, and really willing to ask good questions. Things like the relief. I love relief. I think it's incredibly comfortable for the patient, and those are little disposables. But sometimes you have to weigh out ergonomics. What is the cost of my ergonomics? And HVE. How do I sustain my ergonomics and my patient's saliva flow all at the same time? So there are multiple things that impact the decisions you make. Are you using HVE with a new bird? Are you using the relief? Like, which ones do you like and the why behind it? And sometimes you're going to find that there are some things that disposables are worth their weight for you as far as sustainability for your ergonomics. And then there's other things where you're like, okay, I can use that air water syringe and sterilize it with my in my cassettes instead of buying air water syringes that are disposable. I'm just using these as examples. You guys can look up your own research and do your own thing. I'm just giving these as examples of maybe meeting in the middle when you start in a new practice with sustainability in mind. Because here's the part I want you to really hear. You are entering the profession at a moment of transformation. Practices are having these conversations and rethinking how they use materials, how they educate patients. GBT is a perfect example of how there's been a transformational shift in how patients are educated, how the appointments are structured, and how those practices market themselves to target their specific patient that they want to work with. And how do they reduce waste and cost? How are they remaining cost effective so that they're still sustaining their business and practice in 5 years, that they'll still be working on providing care to patients? So that sustainability plan has to be part of the conversation that they're having in their meetings with the staff. I got to tell you too, guys, hygienists are leading many of these conversations. And this is because hygienists are preventive focused. They are the prevention experts. You guys are the ones who are spending that time with the patients. You're the ones who understand that disease progression, the patient's behavior, the educational component, the biofilm management. And this is what I want you to hear the most of. Sustainability is not just about recycling. It's about reimagining the role of the dental hygienist as a leader in prevention, as a leader in efficiencies, and as a leader in long-term patient health and practice health. This is where your generation shines. I see you guys doing this pretty much naturally thinking about these types of things. Whereas, my generation, I don't think it was at the forefront of our minds as much as I see it with today's student. And I just love that for you guys. So let's make this like an actionable plan. This is what I have to do as a Gen Xer. I have to say, okay, what steps do I need to take? So here's some simple ways that you can practice sustainability today, even as a student. And you guys probably could make a better list than I can. Choosing reusable when your clinic allows, right? Advocating for digital whenever it's possible. Digital medical histories, digital radiographs, digital dental materials, right? Using the Trios or the iTero scanner, using only the amount of products that you need as far as irrigants and varnishes and pastes and things like that. Educating your patients on prevention as a sustainable strategy for themselves. I know I take the time with my dentally anxious patients. I notice that if they come more frequently and they stay up on their treatment, their anxiety level is reduced. So the amount of energy that they expend just to actually have an appointment is reduced. So they actually create their own sustainability plan when you point that out for them to help them recognize that things do get easier when they are more reliable and punctual and hold themselves accountable to keeping their appointments. And really, honestly, guys, educating our patients on prevention as a sustainable strategy can go a long way with our dentally anxious patients. You don't even really think about that until you think about that. And when you think about like lost work time and the amount of energy it takes for them just to get to the office when they're highly anxious, and pointing out to them how much easier it becomes over time can actually help that patient learn their own sustainability plan. So those are things I want you to think about. And here's what I also want to say. You are not just learning how to scale teeth. You are learning how to shape the future of the profession. You are the voice of the profession and how it has shaped as we move ahead. Sustainability is going to be a key hot topic over this next decade for practices, and the hygienist is leading the way. The decisions that you make, no matter how small, all add up to a paradigm shift that can happen right before your eyes. This is not just a trend, guys. This is a movement, and you are part of that movement. Thank you for spending time with me today. I'm proud of you guys. I am rooting for you. I know that you guys will solve this sustainability issue that is going on in dentistry. You will find all of the right ways to reduce waste, increase the focus on prevention, and move our patients into their own sustainability plans that will move them forward in their own personal lives. If this episode resonated with you, share it with a classmate. I love seeing how you're growing and leading in your programs. I look forward to hearing how all things turn out for those of you that are graduating this May. Congratulations on all of your hard work and success. I'll see you in the next episode. Bye, guys.